Hi students, this is Dr. Badrinath and today's topic is Chrono Pharmacology. Completely new term. Chrono means time, pharmacology means already we know. With this topic, I am starting the pharmacology 3 also. Pharmacology 1 and pharmacology 2 already completed and this is pharmacology 3. Chrono Pharmacology, some new concepts will come here. Chrono means time, pharmacology means we know. What is this Chrono Pharmacology? Okay, very interesting, really very interesting. So really we can enjoy this topic. Okay, right. So make this video viral, right? See how the time is. Time. See, a banana, when you are taking a morning, it will be act like a gold. Nearly 5,000 benefits are there. As per the Ayurveda, 5,000 benefits are there if you are taking a banana in the morning. Same banana, if you are taking in the daytime, okay, that is a daytime, it acts like a silver. It is having only 2,000 benefits. Banana, if you are taking in the evening, around 500 benefits are there. So 5,000 to the 500. See how the gradually it is decreasing. See, same banana only. Time is a difference. Person is the same. Banana is also same. But what is varies here? Only when you are eating the banana, that time varies. That's why time varies. Okay, that we will enjoy this really. Okay, so always try to take the banana in the morning itself. Okay, right. In the same fashion, Chrono Pharmacology, propranolol tablets, if you are taking morning, almost double action it shows. Daytime it is somewhat less, but evening time still less. So better to take a propranolol tablet in the morning itself. In the morning. Why these differences? All these differences. That is same propranolol tablet only, same company only. Patient is also same. Only the difference is the time. See, same pharmacology will happen here, but your pharmacology will vary with the time. That is called a chronopharmacology. Pharmacology varies with the time. Yeah, right. So propranolol have twofold higher Cmax, maximum blood concentration of the propranolol, okay, in the blood, and shorter Tmax, that is very fastly to absorb after morning compared to the evening administration. Almost double horse. It acts double propranolol if you are taking morning. Okay, why all these things? I will give you the example. Okay, so if you want to want all the notes here in the YouTube Pharmatrix, for example, in the YouTube channel, I will explain all the videos. Okay, at free of cost only. Everything is free of cost only. Here, this is 100% free. This is 99% free. Okay, only nominal cost I am taking like M.Pharmacy 100 rupees. Okay, B.Pharmacy 250 rupees. Pharma.D 250 rupees. That's it. The remaining, that is also to maintain the data in the clouds. 99%. This is also free initially. But some more subjects I have to upload. I will upload. Don't worry about that. All subjects will be uploaded from time to time. Okay, all important subjects are already there in my mobile app. So it can be downloaded from the Google Play Store. This app, mobile app. Okay, and click on the store option in the app, in the mobile app, so that you can go select the course. B.Pharmacy, Pharma.D, M.Pharmacy, number of branches are there, and you can see the content and you can purchase it. Remaining subjects will be uploaded. Okay, don't worry, but it takes the time. Keep in your mind, it takes the time, right? Pharmatrix, for example, that is YouTube channel. On the playlist, you click on the playlist, okay, in my channel, so that you will get all videos subject wise. You will get. Yeah, what is chronopharmacology? In simple words, the human body responds to the same drug. Human body response, my body responds to the same drug, varies with the time. Morning it works like a double, or evening it may half only, like that. It varies with the time. Okay, same dose, same dosage form, same company, everything is same. Okay, right. Why all these differences? That we will see. This is your syllabus, pharmacology 3. I started Chrono Pharmacology. Here you can see this entire topic. Today we will complete it within 20 minutes, within a 15 to 20 minutes. Okay, definition and see rhythm of cycle. 3 parts we will divide. In the exam also they will ask like a 3 parts. Definition of a rhythm and a cycle. Both are same only. Rhythm and a cycle. Biological clock. This is a part 1. This is part 2, biological clock, and significance leading to the chronotherapy. This is a third one. So total 3 parts. Don't worry, I will use very simple terminology to make you understand. Even it is helpful for the North students also. Those who are studying in the Hindi, they will also you can understand these concepts very easily. Okay, like part 1, biological rhythms. Rhythm is nothing but a cycle. See, rhythm is nothing but a cycle. Biological rhythm is nothing but a biological cycle. It is nothing but body rhythms. It is nothing but body cycles. Almost all are same only. Don't worry. In the examination, don't get confusion. They may use different terminology, but almost all are same. Cycle is equal to rhythm. Rhythm is equal to cycle. Biological is body. Body is equal to biological. See, body rhythms. Why this first part I told now? Body rhythms are nothing but biological rhythms, biological changes in our body that happens over a certain period. A best example, simple to understand, menstrual cycle is 28 days. 28 days, see here, menstrual, whereas a cardiac cycle, 0.8 second. Cardiac cycle, one cycle of the heartbeat, 0.8 second. It is less than 1 second also. See here, 0.8 second. Whereas this one, that is menstrual cycle, is 28 days. So that's why in our body there is number of cycles are there. Number of rhythms. Cycle is nothing but rhythm. Number of rhythms are there. All are having their own time. Own time they are having. Okay. See, body rhythms are nothing but biological changes in our body. See, birth, you take the example of the giving a baby, pregnancy. It is a 9 months. It is a cycle of the 9 months. Like that. Okay. Biological body rhythms are nothing but biological changes in our body that happens over a certain period. What is that period? There are a number of rhythms in our body. All the rhythms, number of rhythms, nearly 5,000 or 6,000 rhythms, are more than 5,000 or 6,000. We cannot count it. We cannot. All these rhythms divided into 5 categories. Depends upon their sign. For example, diurnal. Daytime, nighttime. For example, the release of melatonin hormone takes place in the nighttime only. Nighttime only, there is a release or production of the melatonin hormone. Okay. So that depends upon either night or day. So melatonin takes place in the night only. Circadian, that is circadian, that is called as a diurnal. Circadian, 24 hours. One motion in 24 hours. So you will urge to go to motion in the morning only one time. That is 24 hours, one time only. Okay. Ultradian. Ultradian, less than 24 hours. This is 20. Circadian means 1 day. Diurnal means 12 hours, 12 hours, like that. Ultradian means ultra, less than. Ultra means less than 24 hours. For example, cardiac cycle, 0.8 second. Infradian. Infra means less. Infra means more. Ultra means less. Infradian, 1 month menstrual cycle, 28 days. Circannual, annual. See here, annual means 1 year. That we know. Circannual, 1 year. For example, suicide. This is best example for circannual. Yearly once, there was one patient. Yearly once, the same day, August 16th or August 17th, the person will go and try to suicide. We don't know that. Some psychiatric these things will be happen yearly once, like that. See, we will see all these cycles one by one with quickly. Diurnal. This is a diurnal rhythm, synchronized with the day and night. Same example I have told. This is a daytime. So whenever daylight falls on the eye, nothing will happen. Here there is no melatonin program. But nighttime, what happens when you are closing your eye? Nighttime, melatonin will be produced. This is an example, best example for the diurnal. So 12 hours there is a melatonin production. If you are sleeping 12 hours, okay, 8 hours if you are sleeping, it is almost a 12. You can be divided, no problem. From 6 to 6, it is just like night only. 6 to 6. Okay. See here, circadian rhythm, approximately gastric motility, motion. I have already told you. Series of changes like a body temperature. Circa means approximately. Day means day. Approximately per day takes place. It will go over 24 hours. Example is body temperature will be changes morning one time, evening, like that. Metabolism, digestion process, gastric motility, morning motion. It will be best example for circadian rhythm per day 1. Okay, ultradian, cardiac cycle, meaning less than 1 day. Okay, sleep 12 hours, heartbeat 0.8 second, like that you can be right. And infradian, meaning more than 1 day, menstrual cycle. Circannual, it occurs annually or yearly. Example is suicidal tendency, mood, reproduction, okay, birth weight, sleep. But you write the suicide is the best example for that. So yeah, all these things you have to write in the examination. The cycle during the night, what happens? Some of the diseases will happen only in the night here. For example, see apnea, sleeping apnea. Some people in the sleep itself they will die. That is due to the apnea. Asthma will be takes place. Severe attack of the asthma will be there before wake up. That's why most of the asthmatic patients they will die in this time, early morning. That is a 4 o'clock or 5, 6 o'clock means wake up like that. Okay, asthma, angina. This is angina. And congestive heart failure will be takes place in the night. So all some of the peptic ulcer diseases, exacerbation, all these diseases will be happen in the night time only. Even diseases is also having their cycle. Very, very important. And seizures, epileptic seizures will be takes place after waking up. When you are waking up, epileptic seizures. All these you have to write in the examination. Approximately you have to write the time also. Epileptic seizure, chronic pain will be there, osteoarthritis there in the morning time, sickle cell anemia crisis will be there at the midday, hemorrhage will be take place, okay, angina pectoris will be take place here. So see here, this table is very important. Allergic rhinitis, worst in the early morning. Allergic rhinitis, worst condition. Bronchial asthma, rheumatoid arthritis, same only, same cycle I have showed in the table format only. And like a gastric acid secretion here more, neutrophils, acidophils, uric acid production, and melatonin here you can see melatonin production is there in the night time. Prolactin will be, growth hormone will be, that's why the children they will sleep more time, growth hormone will be released more, they want more growth hormone. Okay, lymphocytes production will be there like this. So production of various our body hormones will be having their own rhythm, Yeah, when you want to break this, there will be breakdown the point for this rhythms also. One is a jet lag effect and shift work. And jet lag, most of the pharmacy students they do not know what is a jet lag effect. When you are traveling from one country to another country, there will be a jet lag effect, shift work. These are the two important parameters. It breaks down the rhythm, biological rhythms will be breakdown. Why I will say you, jet lag effect. See, our total world is having a time zones, different time zones. If you travel in the same time from this country to here, or from this country to here, India, from here to here, same zone, nothing will happen. When you are crossing this time zone from USA to India, from London to India, when you are crossing these time zones, our body biological rhythms will be changes. It going to damage your health. Not only jet lag effect, here you can see, that's why from north to south, see here, north to south, if you are traveling from here to here, no time zone will be crossed. Whereas if you are crossing east or west, if you are traveling from east or west, okay, you are crossing the time zone. Okay, your body rhythms will be changed completely. Okay, that point you have to keep in your mind. That is called a jet lag effect. Your mind will not be worked out. Morning you will be catch the flight in the USA. When you landed here, again here morning will be there. So how your body will taking place? Highly disturbed. Number one, jet lag effect. Number two, shift work. Shift work, night. See, 1 week you are doing a day work. Again, next week you are doing a night work. So you have to wake up. Again, next week, daytime you are working. Like that. Shift work damages your health. All your production of the hormones will be disturbed. Highly disturbed. Because body will be disturbed. Total body. If you are doing daily at night time, no problem. If you are doing a duty daily morning, no problem. But if you are changing the shift work, it was definitely there will be a problem. This is a sleeping cycle of Kumbhakarna in the in the history. that we know very well. His sleeping, our sleeping cycle is 12 hours, 12 hours. His sleeping cycle is 6 months, 6 months. 6 months sleep, 6 months wake up. If you want to wake up the Kumbhakarna, this is a situation. Okay, all the people has to come, they have to climb, even animals has to come. Okay, it has to wake up. It is very, wake up call to the Kumbhakarna is very difficult. Okay, yeah. Next part 2, biological clock. We know electronic parts. Electronic clock we know, mechanical also we know. What is this biological clock? Biological clocks are the organism's natural timing devices regulating the cycle of the circadian rhythm. Best example is pineal gland. Same example you can be right. Now, see, pineal gland is having its own biological clock because melatonin is produced in the daytime. Okay, that is called a biological clocks. These are the organism's natural timing devices. They are composed of specific molecules or proteins interact with the cells throughout the body, just like a pineal gland. Each gland, each part, each cells having differently is nothing but a clock. Nothing but a clock. Each gland is having its own clock. Nearly every tissue, every organ contains the biological clock. That point is very, very important. Okay, in our body, each and every cell having its own clock. Okay, when it has to wake up, when it has to secrete, all the next part of the significance leading to chronotherapy. This is our chronopharmacology concept. Okay, as per the syllabus, we are moving. Chronopharmacology is nothing but study. In simple terms, I have already done how the effects of the drugs vary with the biological timings and endogenous periodicities. Right? Reason for chronopharmacology is chronokinetics. Chronokinetics means we know absorption, distribution, metabolism, and excretion. It comes in the subject of biopharmaceutics. All videos are there. You can go and watch it. Chronokinetics, ADME, kinetics vary according to the time of the day. Absorption will be greater, good at the morning. See, first example, we will see absorption. Most of the lipophilic drugs absorbs faster in the morning time. So whenever, as a doctor, if you are prescribing a lipophilic drugs, you tell them to patients to take at a morning time as possible, because lipophilic drugs here, lipophilic drugs seem to absorb the faster. You will get very good results, very excellent results. This is already proven. Whereas a lipophilic drugs, we know water soluble compound, that is a hydrophilic drugs, do not have any circa at whatever you are giving, it is same work. Whereas a lipophilic drugs, morning it works better. Water soluble drugs, whenever you are taking, same result only. Morning if you are taking, same result. Afternoon, same result. Evening, though there is no circadian rhythm for water soluble, no circadian variation for water soluble. For example, nifedipine, oral nitrates, propranolol. See all these examples. Propranolol, here I have mentioned propranolol, have a twofold higher concentration and quick absorption, shorter Tmax after morning. When compared, see, morning it works like a cold when compared to the evening administration, because they show a greater absorption within the body, absorbed faster. That's why it's showing a very good result in the morning. Okay, in children, when you are applying this ointment, lignocaine hydrochloride ointment, lidocaine, also called as a lidocaine, lignocaine, same only. Okay, when you are applying a evening time, penetration is faster. High penetration was observed in the evening time. So you apply the lignocaine in the evening. Next, that is absorption. Now distribution, ADME, distribution. In the distribution, highest plasma level of free phenytoin. See here, during the distribution, there is a two types of drugs in our body. When you are taking swallowing a paracetamol, paracetamol will be two forms: bounded with the protein, unbounded with the protein. Okay, like that. It comes in the concept of biopharmaceutics and all videos are there. Highest plasma levels of free phenytoin is observed between the 2 to 6 hours. That point you have to keep in your mind, so that action will be super. Highest phenytoin action will be super in the 2 hours to 6 hours. Lowest levels of free diazepam, and carbamazepine is in the less. Free diazepam, free carbamazepine in the morning less. So that's why don't take diazepam and carbamazepine in the morning. Drug binding to the erythrocyte, that is a drug bites with the RBC, is found in the is a time dependency. Like all these are the lidocaine, bupivacaine, etiocane, all these whenever you are taking now, that depends upon the time only it go on binds with the erythrocyte. And next is metabolism. Metabolism will be take to see your drugs are rapidly break down. Liver enzyme activity is 2 hours and lower. More enzyme to after 2 hours. That is a 2 hours. 2 hours means that is a 2 o'clock. This is a 4 o'clock at low at 14 means again 2 o'clock. This is a night and a day like that. Okay. This is a early morning. Early morning 2 o'clock. That is at after crossing a midnight. This is afternoon 2. This is a night to 2. Like that you can remember. Liver enzyme activity is more here. So whenever liver enzyme activity is more, breakdown of the drugs will be very easy. So there is no drug concentration in the body. Drug will be keep on eliminating. So drug will not be work out in this time. Whereas at 2 o'clock, that is 14 o'clock, liver enzyme activity is less. So more drug concentration will be there in our body. Okay, so you will get a very good action in this time. See, all these are the various examples like GAT motility, gastric secretion, okay, pH, gastric emptying time, drug protein binding, liver enzyme activity, hepatic blood flow, glomerular filtration, renal blood flow. Number of parameters will be having its own circadian rhythm, like anesthetics. These drugs acts according to the cycle. Cardiovascular, anti-inflammatory, anti-cancer drugs. Okay, if you are taking morning one result, evening one result, night one result, like that. These are the so whenever you are prescribing this, you can apply this Chrono Pharmacology to these drugs. Okay, Chrono Pharmacology you have to apply to all these drugs. Okay, because it shows the circadian variation. And diseases, nocturnal asthma, angina pectoris, myocardial ulcer diseases comes in the early morning. Okay, this is the disease. Already I have shown the same thing only. I am writing in this one. Cyclosporin. Here, this example you have to write. Displaces the higher Cmax, higher AUC in the morning than after. So take a cyclosporin in the morning. This is an immunosuppressant drug. Okay, like that. Yeah. And thank you. So I will end my session here. All these examples you have to write in the examination. Very, 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 very important. Right.